For hearing loss in children, it's critical to recognize hearing loss symptoms so that your child can get the care they need. In this video, I'll cover causes of hearing loss and hearing loss types. Coming up. Hi, I'm Dr. Derek, audiologist, audio engineer, and musician with ProFitHearing.com, bringing you the best insight in today's latest hearing aids, headphones, and audio technology to improve your life. If you have concerns about your hearing, always consult with your local physician or audiologist. Today I'm talking about hearing loss in children, causes, and types. According to the Centers for Disease Control and Prevention, or the CDC, in a 2017 survey, 1.7 out of 1,000 babies screened for hearing loss in the United States were identified with hearing loss. Newborn hearing screening is completed before a baby leaves the hospital. If a baby fails their newborn hearing screening, the testing is repeated, and then further evaluation can be completed by a pediatric audiologist. It's important to identify whether a child has hearing loss as soon as possible so that your pediatrician can recommend an appropriate treatment plan. Impaired hearing can significantly impact speech and language development and overall communication. Your pediatric audiologist can make recommendations on whether to proceed with hearing aids or possibly cochlear implants. Note, however, that parents of children who are born deaf may choose not to treat hearing loss and instead pursue sign language for communication. Ultimately, it's the parent's decision on whether or not to treat hearing loss. So what are some signs of possible hearing loss in babies? The baby responds to loud sounds but not other sounds. The baby doesn't startle to loud sounds. The baby doesn't respond when their name's called. The baby doesn't localize to sounds in their environment by 6 months of age. The baby doesn't use single words like dada or mama by 1 year of age. What are some signs of possible hearing loss in older children? The child has unclear speech. The child listens to the TV at a loud volume. The child has difficulty following directions. The child has speech and language development delays. The child has difficulty understanding speech in noisy situations. If your child demonstrates some of these possible hearing loss symptoms, please consult with your pediatrician for guidance. A pediatric audiologist can evaluate your child's hearing. If you're receiving value from this video so far, please hit the like button so that more people can see this content and benefit from it. So what causes hearing loss? Hearing loss in children may be congenital or acquired. Congenital means they're born with it, and acquired means the hearing loss onset occurred sometime after birth. Acquired hearing loss may occur before learning to speak or after learning to speak. Congenital hearing loss is genetic in 50 to 60% of cases and can be dominant, recessive, or X-linked, meaning from genes found on the X chromosome. Genetic testing can determine if a hearing loss is a result of a genetic abnormality. Genetic hearing loss may be non-syndromic, meaning no other symptoms, or syndromic, meaning there's a presence of hearing loss with other symptoms. Some examples of syndromes with hearing loss or syndromic genetic hearing loss include Down syndrome, Usher syndrome, Waardenburg syndrome, Treacher-Collins syndrome, Alport syndrome, Pendred syndrome, and others. An example of non-syndromic genetic hearing loss is a connexin 26 protein mutation on the GJB2 gene. Connexin 26 is important in the cochlea's development and function. The cochlea is the part of the inner ear that contains the hearing sensory cells called hair cells. Any abnormality in the inner ear can cause hearing loss. Congenital hearing loss may also be caused by various medical conditions, which can include the following: prenatal infection, illness, or toxins from mom. Rubella, herpes simplex, cytomegalovirus. Anoxia, meaning the baby doesn't have enough oxygen. Maternal diabetes, premature birth, preeclampsia. Please consult with your doctor and complete all recommended checkups during your pregnancy. Acquired hearing loss may be the result of the following: otitis media or ear infection, noise exposure, head injury, ototoxic medication, meaning toxic to the inner ear, chickenpox, meningitis, measles, mumps, influenza, encephalitis, jaundice. Okay, now that I've covered symptoms and causes of hearing loss, let's discuss the different types of hearing loss. There's 3 types of peripheral hearing loss, meaning occurring within the ear. These types include conductive, sensory neural, and mixed. Conductive hearing loss can occur in the external and/or middle ear. This just means there's something abnormal with how sound travels into the ear canal and through the middle ear. Some of the most common causes of conductive hearing loss include the following: earwax buildup, also known as cerumen buildup, fluid in the middle ear due to an ear infection, abnormal function of the ear bones where they cannot vibrate normally, or an eardrum perforation, hole in the eardrum. There may also be congenital causes for conductive hearing loss. This can include microtia, which is an underdeveloped external ear, and atresia, which is a narrow ear canal or absence of an ear canal. Conductive hearing loss may be improved or reversed with a variety of medical or surgical options if determined to be appropriate by an ear, nose, and throat physician or ENT doctor. Sensorineural hearing loss occurs in the inner ear and is permanent. It's caused by damage to the hair cells inside the cochlea or by damage to the auditory nerve. Sensorineural hearing loss may be the result of a genetic abnormality, ototoxic medication, noise exposure, an auditory nerve tumor, illness or disease affecting the inner ear, or head trauma. Hearing loss can also be mixed. This is a combination of conductive and sensorineural hearing loss. In addition to the types of peripheral hearing loss I've discussed so far, hearing loss can also be central, meaning that it's caused by a lesion in the central auditory pathway or cortex. The inner ear sends signals to our brain in response to sound, and the brain's auditory processing center makes sense of all the sounds in our environment so that we can communicate effectively. If you're looking for more information and resources on hearing loss in children, please refer to the link in the description below from the Centers for Disease Control and Prevention, or CDC, A Parent's Guide to Hearing Loss. Please like this video if you receive value from it, and let me know in the comments below what questions you have about hearing loss in children. If you like this content, please subscribe and hit the notification bell. Thanks for watching, and I'll see you in the next video.